Morning, everyone. I think we're going to get started, even though I think a few more people may trickle in over the next little while. Thank you also very much for joining the second seminar in our series. It's great to see so many people who've joined us again, and it's also great to see some new names. Thank you very much. Apologies for the confusion about the invitation and for sending multiple invites. From the next session, we'll be shifting to a Thursday, and I think that caused a few hiccups. But I'm glad that so many people were still able to make it today. So today we will be focusing on ethical issues, in particular, as we think about both remote data collection and adapting methodologies, and as we start to think about returning to the field in some instances. I think for many of us, ethical issues are front and center of our minds, and this applies regardless of what kind of research it is we're doing or how we're trying to do it. There's a lot of new challenges that have come up as a result of the current pandemic. And of course, the previous sorts of ethical challenges we're all familiar with haven't gone. So we're really fortunate to have three speakers who I think will reflect for us on quite different aspects of ethical issues. We're first of all going to be hearing from Dr. Mokhantso Makoae from the HSRC Research Ethics Committee. She's going to be speaking to us about research ethics reviewing during COVID-19. Our second presenter will be Dr. Abby Hatcher, who works from the Wits University School of Public Health, as well as the University of North Carolina, Chapel Hill. And she's going to be speaking to us about the ethics and practice of intimate partner violence research in COVID-19 surveys. And then finally, we've got Mr. Mfundo Majola from University of Western Cape, who will be reflecting on his experience with the Lockdown Diaries project and the use of remote research through that project, with a particular focus on issues of ethics that they've encountered. I'm really hopeful that through this lovely diverse grouping of presenters, we're going to get some quite different perspectives, thoughts, ideas, and questions. And I'm also very much looking forward to input from audience members. As we did last time, we'd ask you to please pop questions in the chat box as we go along. Please send them through to everybody. Stembiso will be collating questions as we go along. And we'll be sharing that at the end of each speaker's slot for them to respond to questions. Just a reminder also to please make sure you're muted and your microphone is off throughout unless you're speaking, just so we can preserve bandwidth for everyone. Great, so with that, I'm going to hand you over to our first presenter, Dr. Mokhantso Makoae. Over to you. Stembiso, I think you'll need to turn off your screen. Great, thank you. Mokhantso? Hi, Mokhantso, I'm not sure if you're still muted.
Morning.
Morning.
Yes, I got lost for a little while.
Wonderful, no problem.
Thank you very much. Will I be controlling my slides, or Stembiso is helping me with the...
No, you'll need to share your screen now and then control your slides.
Okay, that's fine. Thank you. I just needed to go to the first one. Good morning, everyone. And I'm sorry that I deviated slightly from the title of the presentation that is provided in the program. I thought I would want to share some of the things that I thought were important experiences of the HSRC Research Ethics Committee. I'm a member of this committee and I've been serving on the committee for the past 7 years. This November, I will be ending my service on the committee. And for the past 5 years, I have been the deputy chair of the committee. And the committee is led by Professor Teresa Rousseau at the University of Pretoria. And she's deputized by myself and another external deputy. So I thought I will talk about adaptation. I'll talk also about responsiveness, and also I'll talk about support. And you know that HSRC is established by the Act of Parliament, and it is a council that is under the Department of Science and Innovation. And by law, it is required to conduct research that supports a developmental agenda in the country, but also across the continent. And
Mokhantso, sorry to interrupt you. We're not seeing your slides at the moment. Would you like me to share your slides?
Can you not see the slide?
No.
Oh, okay. So I put it on.
You'll need to press the share screen button again, I think.
Okay, let me see what could have happened, because I thought I was already there and can I end this show and then start all over again?
I think so.
Okay.
Otherwise, Mokhantso, I can share for you if you'd find that helpful.
I think so, because I seem to have lost myself on the screen already.
Can colleagues see that correctly?
The first slide, that is labeled number 2.
Is that correct?
Yes, okay. So I'm sorry about that. So I was trying to...
Sorry, I'm so sorry to interrupt. I can't see anything, and I can see in the group chat that no one else can see the slides. So
oh, goodness, so sorry.
If there's an issue, I'm not too sure.
Yeah, let's just try and sort it out.
Julia, sometimes.
Colleagues, is that working now?
Yeah, that's working.
Oh, wonderful. Thank you all. Apologies for this.
Okay. Thank you. So I was saying that the responsibility of the HSRC REC is to conduct formal ethical review of research that involves human beings. And that is done within the national legislative framework that is provided through the National Health Act of 2003, but also through the establishment of the National Health Research Ethics Council. There are guidelines that have been provided for all research ethics committees in the country. And those guidelines of 2015, together with the Health Act, National Health Act of 2003, they provide the national legislative framework that is followed by the REC, the HSRC, to review protocols that are meant to conduct research on human participants. And the HSRC REC has adopted a formal review framework that it has basically formulated into a form. So when people submit their application forms, applications for review, they complete an application form, and that form is guided by a review framework that REC has adopted. And it is based on some 8 principles that have been formulated and reformulated over time, but basically try to address the 3 main ethical principles that emerged out of the Belmont report as we know it. And I want to indicate also that as part of the introduction, that when the COVID-19 arrived in the country, for the HSRC REC, this was not the first pandemic that it was going to deal with or to address in the form of reviews that come to it. HIV and AIDS has been one of those major areas that HSRC research has contributed to in terms of reviewing ethics, providing ethical review for protocols that are submitted. But immediately when we started receiving COVID-19 applications, it became clear that we were dealing with a very different kind of pandemic, very different from HIV problem, in as much as we thought, and some of the principal investigators who submitted applications thought that there could be a lot that we could draw from HIV experiences. Immediately, it became clear that at a point in time where we are dealing with COVID-19 applications for review, there is limited scientific knowledge, and that creates uncertainty. And I think this is what many of us understand even within the larger environment in relation to policy, in relation to national response to COVID-19. It's becoming clear that the knowledge base that is helping government to respond to the pandemic is also characterized by the uncertainty. It is evolving fast, and the pandemic itself it's creating heightened levels of vulnerability in the population. And this vulnerability sometimes include or affects even study participants. Next slide, please. So I thought I would also talk about how I would characterize the REC environment at the moment in the context of COVID-19, and indicate that what the committee has seen is creativity on the part of researchers. And this covers everybody from early career researchers to those who are established specialists who are doing research in this in the area of COVID-19, or who are doing studies which are not necessarily related to COVID-19, but are taking the context of COVID-19 into consideration. We see a lot of creativity in terms of the methods that researchers are adopting. They have adapted, or they are trying to adapt their studies to the context. And on the part of the REC, I will talk about flexibility and indicate that for the first time, the REC mainstreamed emergency reviewing of applications. And this has been implemented in particular in relation to COVID-19 studies that require rapid implementation. The turnaround time has reduced significantly. There are reviews that are done between meetings, and sometimes the return takes about 5 days, but in terms of the standard operations procedure, we have it at 10 days. We also see support and understanding on the part of the HSRC senior management. And this has been from the very beginning, when the Research Ethics Committee realized that there was a need to do our business differently. There has been that support, provision of opportunities to hold meetings with management to discuss issues that affect REC decisions, and also in terms of how the HSRC management could support the committee. There is also overall collegiality, and I have already talked about consultations. There's a new practice. In the past, the REC had a standing practice that applicants could attend meetings where their protocol was going to be discussed. That was the practice. So members of a research team, either the PI or any one of the research team members, could attend. They could provide the committee with clarification when their protocol is being reviewed. All they would be requested is to maintain confidentiality. And what has now happened is that some researchers, some PIs, may have difficulties with some of the recommendations that REC has put on the review report, and instead of just submitting because they've been requested to resubmit or waiting for the next meeting, they request consultations in between meetings. And the REC has from time to time looked at individual cases and decided what kind of support can be provided. And I think this is because during this time, there seemed to be that understanding that we are learning together. Unlike perhaps in the past, where the researcher will be saying, this is my field, I know what I'm doing, so I'm going to give REC this response, or REC saying, this is what the committee has found, So we're going to request the applicant to adhere to what is being requested. We find that there are now consultations, there are discussions, and it is a different kind of environment. Next slide, please. Right, so here I'm talking about the requirements for ethics, for ethical research review, and I'm talking about the framework that I referred to, that I said is the framework that the committee uses and is according to the study that was done by Emanuel et al. And they were looking at principles of conducting ethical research, but focusing on clinical research. But this has been adapted through other studies, analysis done by Dr. Wassenaar and colleagues, and it has now been adapted to the social sciences. And I was indicating that this framework, the 8 requirements, that the form that HSRC REC uses when we review applications are based, there are different parts to the form, but those different questions that the PI is asked to address basically try to address the 4 principles that are indicated here: the principle of non-maleficence, beneficence, respect for autonomy, and finally, justice. So we use this guideline that was developed by Emanuel, and the questions that are asked are formulated to deal with those. What I want to indicate in relation to the first principle, the principle of collaborative partnership, which is the first principle that is indicated by Emanuel and colleagues in their publication, is that this has always been a principle that the committee considers. But at the moment, I think there is a lot of emphasis on this principle. Because I think what we realize is that because of the uncertainty that I referred to earlier, because of the limited knowledge, and because of the desire by the committee to try to promote ideas and also values in the science community that says we need to collaborate and form partnerships with communities, and we have different ways of defining communities. And the emphasis that we're making is that unlike what we would request in the past, for example, that the PI should provide, for example, as an indication that they are collaborating with the communities involved, to provide permission letters. That was a standard request. Provide permission letters as an indication that people who are responsible for leadership in these communities, whether it is an organization or whether it is a village or whether it's a town or a municipality or province, have allowed you, or they are working with you to execute this research. And that letter would be sufficient. Now we are requesting collaboration plans, that researchers develop collaborative plans that indicate how they engage with the communities, how they provide pertinent information about the study to the communities, but also because we recognize that at the moment, there may not be clear benefits, especially immediate benefits to participating communities, given that even in terms of pharmaceutical treatments, there isn't much that communities can benefit. Trials are taking place, but most of the research that we are talking about would not be providing that kind of benefit to communities. Given the time that communities are going to contribute to the studies that are being implemented, their contribution in terms of responses and their collaboration and support for studies, what kind of collaboration is the scientist promising, and what are they providing to the communities as something that they can leave them with? And we're emphasizing on creating awareness and also making sure that whatever they do when they conduct these early studies that are taking place, they are giving communities the understanding that everybody is working towards finding solutions to the existing problem. And I think that is a change that is in the form of change of emphasis that I see in relation to how we are focusing on collaboration with communities. And the second principle is that of social value, and who are the research beneficiaries. And that is also something that we are considering. And I have already alluded to the fact that at the moment, the benefits of research seem to be maybe not too clear at the moment. Most of the research that is being conducted does not promise those immediate benefits to communities. And it is also clear that it is research that is being conducted under difficult conditions that require people who are participating in research to go out of their way in unusual ways. For example, in terms of participating through social media, if you did not register on a social media platform to basically participate in research, if you find that your being present on that platform is now being, your time is being taken up by research, the issue of social value of that research has to be clear. And it has to be clear in terms of how are these communities benefiting, or how are they going to benefit. And I think what has become clear from the ongoing and recently completed research that was reviewed by the committee is that most of the research was intended to feed into the national response to COVID-19. And because of that, the question of social value was very clear to the researchers. But that also can be a problem when the researchers think that there is a clear social value for their research, that they do not spend time to explain it in the protocol because they believe that it is obvious. It is obvious why they are doing the research. But also the question of how do we design the studies and how are they impacting on health systems. The other issue and which is also, it's not a new experience, the issue relating to the third principle of scientific validity. This has always been important, and it is always an issue that is quite contentious in the review process, because most of the time researchers are submitting protocols based on proposals that have already won a bid, for example, that has already won a grant, and their study design, their science has already been evaluated and found to be satisfactory by those who were evaluating the application and who funded it. So when the committee requests certain aspects about the science of the application, the science of the study, sometimes there is that resistance on the part of research of the researchers, because they feel that the committee might be overreaching, that there shouldn't be, it shouldn't be one of the things that the committee looks into, like I'm saying, where they feel that the study has already satisfied the basics in terms of what was required by those who wanted to fund the study. But what we find now is that we need to make sure as a research ethics committee that the designs that are being proposed, most of all, they are feasible, that they take into consideration this new context that we are talking about, that they are also safe, and they are also minimizing harm. And these are not new considerations, but given the nature of the problem of COVID-19, we realize that these are issues that we are paying more attention to, perhaps even more than before. But some of the applications that we have, we realize that they have adequately adapted to this requirement. And some of these studies that were already in the field when the problem of COVID-19 started had to be discontinued, had to be suspended, some of them, and others had to be reconsidered along the same line of what was feasible now that we had this measures that need to be taken into consideration of social distancing and others that came with COVID-19. So these are some of the things that the committee is paying attention to. And I think one of the things that I could share has to do with in terms of the methods. We all like to do focus group discussions, and we know why we want to do focus group discussions. They are quite efficient. They will generate a lot of data, rich data that we need for whatever study we are doing. And wherever it's feasible to have focus group discussion, that is one of the methods that researchers will go for, especially qualitative researchers. But we find that now there are a lot of requirements in terms of retaining scientific validity of these methods. How can they best be designed and be conducted under the current situation? So this is where the creativity of researchers come in, the technologies that they use, and how they adapt those technologies to continue to use the focus group discussion method under the current circumstances. So the other one, which is the fourth principle, is that of first selection. And what are our experiences?
Mokhantso,
Yes?
I'm sorry to cut in, but we're gonna need to wrap up your presentation in the next 5 to 8 minutes.
Thank you very much.
Okay, thanks so much.
The question of fair selection, the challenge that we're coming, or one of the experiences here, has to do with recruitment. Because of the constraints that we have in relation to social distancing, for example, one of the challenges is that you'll find that the studies are using digital technologies. And it means that those who come to participate in the studies are those who have this means of communication. So the question of fair selection, who is being included, who is being left out. But also we find that researchers are being creative in the sense that, especially those who are interested in studying children, they are aware that they cannot depend on perspectives of adults or parents. And they have found ways of reaching children and including them in studies that are suitable for child participation using these methodologies. So what I'm trying to say is that there are these constraints, but at the same time, there are lots of creativity that is happening in order to address the limitations that researchers are facing. The next one is that of informed consent. I think in relation to this one, the major experience that we have is that which has to do with sometimes researchers feeling that the topic is complex, is too complex. They don't know how to point out to the limitations of science in a context where science is known to provide most answers in relation to our lives. So you find that the informed consent form does not have all the information, or some of the information is watered down and does not provide the needed detail because of this assumption that this COVID-19 is a complex thing, or some of the methodologies, especially in relation to epidemiology studies. Some of the methodologies are complex, even their tests are not as clear-cut as other epidemics that we have dealt with. So researchers also worry about unintended consequences of some of the information that they might give to study participants, which might change later. And they feel the responsibility to not create wrong impressions or promise more than what is can be promised. So these are some of the things that we are dealing with as a committee. But I think I will go to the eighth principle, that of respect for participants, where we really insist that it is important that participants involve themselves in these studies, that they participate with full understanding of what is happening, and that they are provided as much information as possible. And so let me reiterate what I said earlier, that the REC business has changed significantly. And like I have indicated, there are these consultations that are taking place, but also the REC has taken upon itself that it does not only protect communities and participants, that all its key stakeholders need to be protected, researchers and field workers. In the past, most of the comments that will be coming from reviewers will be focusing on ensuring the safety of study participants. But more and more we see that there is also this focus on researchers and field workers. And it must be indicated that this kind of concerns, and which are concerns that we should be not ignoring, has to do with the fact that we are dealing with a volatile environment, but also we need to take into consideration that these concerns and the need to ensure safety of all who are involved in research has cost implications. So there are things that we are requesting to see in research proposals, in research plans that were not usually asked for by the committee. And right, maybe I could also indicate the kind of studies that we have had. In terms of designs, we have had social surveys, we have epidemiological studies, we also have qualitative studies that we have reviewed. The data collection methods are online or digital. They use social media, and also Photovoice is one of the techniques that have been used. And I have already discussed focus group discussions. And populations include adults, youth, children. We have also had a study, at least one, that was looking at employees, and the unit of analysis at household and individual level. Right, I think there is duplication that has happened there. The final slide. What are the issues? I think what we are now looking at are issues relating to feasibility. What is feasible, given all the requirements that are there in terms of the national response and the guidelines that we have? Social distancing, for example, concerns about safety, and in relation to the different levels during the lockdown. During level 5, we're particularly concerned about legality and not getting participants into trouble or field researchers themselves into field workers into trouble. And also the whole issue about science and ethics and the question of uncertainty with some of the procedures that are used. And I have also indicated this issue relating to risk-benefit ratio assessment, that sometimes there is this tacit sense that the study is important and that it is obvious, its importance is obvious, and there isn't much of effort that is done in terms of providing risk-benefit assessment. I think the other issue, which is important, is data costs. And going forward, we'll need to be thinking about how to compensate those who participate in this research that is being done using these new technologies. How do we compensate them for the cost that they incur? And what does this new way of doing research and the limitations that are in the field, what do they mean for some of the disciplines? For example, if we are thinking social anthropology. But what I can say finally is that I don't see the committee going back to the old norm, and what the committee has been able to do during COVID-19, I don't think its stakeholders will settle for anything less than that. So there has to be new ways, and what has now been established until now has to become institutionalized, and it has to be the way the committee does its business. Thanks very much.
Wonderful. Thank you so much, Mokhantso. That was absolutely fascinating, and you've definitely raised a lot of things for me to think about that I hadn't previously considered. And judging by some of the questions coming through, I think you've given a lot of us a lot of food for thought. Thank you very much for that. In the interests of time, I think we're going to move straight on to Abby's presentation. Stembiso, could I ask you to just send through to Mokhantso the questions that you've collected, and perhaps she can respond to them on the slide, and if we have time, we'll talk through some of them at the end. Abby, over to you.
Great. Can you just confirm, Julia, that you could see my slide?
I can. Thank you so much.
Okay. Morning, everyone. I'm going to try to put my video on, but if it causes any trouble, Julia or Stembiso can let me know. So I think that the Mokhantso's presentation was kind of a nice intro in a sense, because she was able to talk through the high level ethical implications of some of this work. And what I'd like to do is really think about the practice of this. So I think we're all quite aware that COVID and partner relationships have a very tight intersection, and there are many concerns in a lot of settings that some of the lockdown restrictions and other COVID concerns are leading to more violence in relationships. So we know in South Africa that especially towards the end of lockdown, there were some high profile femicides, which is the kind of death of a woman that's caused by the hands of her intimate partner. So murder of a woman. We had several of these, and it really renewed national focus on how we can think about partner violence, especially in the time of COVID. So we have been seeing lots of these kind of news reports from around the globe, but those of us in research know that, you know, anecdotal evidence for increases in violence doesn't always mean that there are actually new cases. It doesn't always indicate the actual trend. So, like, even the World Health Organization is starting to try to draw attention to some of the existing research on violence in the COVID era. But the best report that I've seen to sort of summarize what we know from the academic research is by Amber Peterman and colleagues, who have done a systematic review. And what they've found is that there are only studies so far from high income settings, and that these studies have a mix of results. Some are finding that violence is getting worse, and some are finding that violence is getting better. Now, there was one study in a low income setting that's in Bangladesh where the violence around the time of COVID was getting worse. But the findings are very mixed. In the US, some of the findings are that violence is worsening, and some is that it's actually improving. And several settings like Canada, Mexico, Australia are actually seeing that partner violence is about the same. And so the truth is, you can see from our region, we just don't know. We have no idea what is actually happening in homes around the time of COVID. And so because I'm a violence researcher, that to me indicates such a gap in what our knowledge is, that it makes it important to consider asking about violence. So I want to...
Sorry, we've just got a request if you could put your slides into presentation mode. Some people are struggling to see everything.
Yeah. Great. Can you see that?
No.
Okay. Let's see.
Sorry, colleagues, if I can just jump in here. It depends why, just check, try and understand why you can't see the full slides. Possibly if you move your mouse over the screen at the top, there's an option, view options. And you can change the way that your screen is arranged. I know from past experience, sometimes it's the video icons that's blocking your view, for example, at the top. So
great. Can you say that once
Christian.
more, Christian? Sorry. So presenter view slideshow. Here we go. Can you see this?
so now
I'm not seeing any slides right now.
Christian, what would you recommend under view?
okay, so you can just share your screen, Abby, as you've done before.
Okay.
The other participants can change the way in which their screen is arranged.
They go to view.
Yes, so you just share your screen and put your slides back up. And possibly other participants, if they can't see all your slides, just change your zoom ratio to fit the window, or change the zoom slightly.
Does it help if I turn off my video?
You can try that.
I think we may just have to push on otherwise, and we will make the slides available through our website.
Okay, I've turned off my video and I'm just going to keep going.
Thanks, Abby.
Okay, so sorry. So just to the big picture is that I think we have so little concrete information about violence in COVID from any sub-Saharan African country that I think there's a real need to think about asking about violence. And so I want to talk through some concrete steps to do so. So the first portion is, how do we even ask? In telephonic research that we are doing in the time of COVID, how do we ask? So there are a few steps. First, we really do need to set the stage for participants. And this almost never means that we are going to call them once and speak to them straight away. This almost always means we need to schedule a later call and ask them to find a safe and private space. And that actually applies to any research, whether you use violence questions or not. And we want to have a good, clear discussion about the research before, but when you involve violence, don't actually speak about the word abuse or the word violence in your consent form. Rather, just talk about good and bad parts of a relationship and things like relationship conflict or stressful times. We want to make sure that we're speaking to someone who has safe access to a phone. And if they are sharing their phone, we want to know that so that we can identify the best way to talk to them. So if you're, say, asking some basic sociodemographics, and then you're about to start a section of your questionnaire about violence, you always want to check in again. And so you might say, I just want to make sure it's safe for you to talk about your relationship right now. Can I talk with you about that now? Shall we do it at a later time? Or do you want to skip those items altogether? So it's a way of reconsenting them to make sure it's a good moment to speak about violence. And you want to craft your violence questions in such a way that are neutral. So whatever words she says, or even he says, whatever words your participant responds with, you want them to be neutral. You don't want them to be able to speak out loud any words that would cause any like risk of further harm. So you just want to have yes or no answers, basically. So we've used 7 different data sets around the world to try to pare down the violence items that are asked. And we have come up with basically 3 items that in these different countries where we were working, these 3 items have really good sensitivity and specificity around detecting a case of partner violence. So the first is, since COVID started, has your partner slapped you or hit you with a fist or something else? So we've found that this single item has nice sensitivity and specificity around physical violence. The second item, did you agree to have sex when you did not want to because you were afraid your partner might harm you if you refused? So this is a nice question. I know it's quite wordy, but it's a good question to ask because it's not actually asking about sexual violence. It's not actually asking about rape, but it is asking about sexual coercion. And so it's a really nice kind of proxy measure for sexual violence without asking about an illegal activity. And then the third item is just to ask, what about the year before COVID started? Did those things happen? And that's important because, you know, if a woman was already in a violent relationship, then she started experiencing violence in COVID, it's possible that her relationship just continued along as normal. So it's almost like getting a very rough baseline estimate of what were things like during normal times. So when we're asking about violence, we really want to make a plan with our research team for like the worst case scenario. And these aren't going to happen very often, but we want to make a plan for them so that if they do occur, the research team is ready. So a really important plan is that we want the research team to have a script in case any other family member besides the respondent takes the phone. So they might have a script like, hello, we're just talking to neighbors about how things are going right now, but we can call back later. So you don't want to disclose the topics of violence or family conflict to anyone but the respondent. There's also a couple of really important data quality things that don't have to do with violence especially, but they become really important. We want to make sure we're talking to the right person in the household. So we might ask them to identify themselves in a certain way. And then we really want to watch our teams our research teams quite carefully when we're doing this telephonic work, just to make sure that they are actually collecting the data, and that there's no fraudulent sort of making up of data. The reason I'm pointing that out is especially when our research topics are difficult or complex, like partner violence, I think there can be more of a tendency for teams to take shortcuts and to like make up answers, because these are kind of uncomfortable questions to ask. But I want to talk about how we can then, in a little bit, I want to talk about how we can train and support our team so that they don't feel uncomfortable about those items. All right, so what happens when a person we speak to says, yes, I am experiencing violence? The most important thing ethically and practically is to offer them some help. And so when we're doing these telephone surveys, we want to give them options of how to offer this help to them. So if they disclose violence at the end of the interview or after the violence section, we might say, I have some referrals for you. Would you like to learn them right now? Do you want me to text them to you later? Or do you want to skip the referrals? And based on our experience in Joburg, a lot of people will opt to skip the referrals. That's not a problem. It's up to them. Remember that they've been navigating these violent relationships for a long time, and they're very skillful at staying safe. So they might not want your referrals at all. But if they do, you want to give them options of the safest way to tell those referrals to them. You really don't want to be asking them ever any of the stories around the violence. And this is for two reasons. It's to protect the participant, because you don't want them to be sharing details and have their violent partner walk in. But it's also to protect your research staff, because unless your research staff is trained at debriefing sort of trauma stories, they may not be able to manage long stories. So you really want to keep things short and tight and ask the researcher to stop a participant if they're about to tell a story about the violence. Those stories are very appropriate for the referral space and for a counseling space that you can then help the client go to later. So you want to spend some time with your team finding the right referrals. And often this can be done by telephone. You just want to phone each referral that you're thinking about and make sure that they're open during COVID times, that they can take on new clients, and that they're able to answer the phone like normal. You know, a lot of times people aren't working from the office, so we need to get cell phone numbers. I just wanted to show you an example of a South African referral list that a team built in the matter of 2 days. Basically, there are a group of activists and practitioners that I'm a part of. We wanted to find which national services in South Africa would be open during the lockdown. We split up a very long list of referrals and phoned every single one. And at the end of just everyone, let's see, about 5 or 6 people volunteered 1 hour to this task. And we were able to come up with a national referral list of shelters and counseling that would be available during level 5 lockdown. And just to say, South Africa is unique because we have a lot of very dynamic and active services. So for example, the National Shelter Movement is an incredible group that has organized for Uber to come pick up a woman who needs a shelter in multiple provinces. So I don't believe that a lack of referrals can possibly be a reason to avoid asking about violence. I think that the referrals are there, and if you require help kind of compiling them, there are certainly South African experts that can help you do that. There's also one more thing about referrals. like I said before, women may not take them up. So you want to give your team a script of what they can help women do to stay safe on their own. And so I think these 3 points are a really nice set of just reassurances to women that if they can reach out to people they trust, if they could call a hotline, or if they could seek out their own referrals, that would be helpful to try to stay safe. Okay, so one of the most important sets of investments that you can make for asking about IPV is training your team well and then supporting them to do the research. And the great part is any investment you make on this is going to help your data quality, it's going to help your team cohesiveness. So it's all going to be good for your study altogether, but it's essential for asking about violence. One of the things I would recommend is that you add a violence expert to your study team. And I've put my email here as well as on the last slide, because I know some of the researchers working in South Africa. I'm happy to link you up. That just can really help your team feel able and ready to ask these violence questions. Another thing you need to think about carefully is how you hire field staff if you want them to ask over telephone about violence. So you do want to let them know before you hire them that they're going to be asking about these difficult and sensitive questions. And you want to, if you can, assess how they've dealt with difficult research in the past and how resilient they are. And this goes back to data quality, but if you're going to ask your team to work from home, you just want to be really careful about who you hire, because again, there could be some risks of having them work on their own that in terms of quality. Okay, so I recommend that if you're training your team, you have a bit of a general ethics training, which you're already probably doing. Then you add another whole module that's specialized around violence. And I have developed a set of activities that is available on ResearchGate. And so I've given you a tiny URL that you can look up, or you can just Google ResearchGate and Abigail Hatcher, and you'll see this project that I'm starting about how to train teams to ask about violence. But this is like a maybe 3 to 4 hour training manual that I think can really set the stage for helping a team ask about violence. Okay, so once you've trained them, you need to be able to supervise them. And actually, these are kind of steps that you're already doing. Probably you're calling your team, you're making sure everyone's available by WhatsApp to check in. But this is particularly important when you're talking to participants about sensitive items. So you want to be able to support your team to make sure that they are dealing with the disclosures of violence okay. And remember that almost every team we put together in South Africa is going to have survivors of partner violence in it. And if there aren't survivors directly of violence, they're going to have partner violence in their family or in their friends group. So supervision by checking in through phone is essential, because asking these questions of participants brings up our own history and our own emotion. So you really want to plan in extra time for the team supervisor to be checking in with people. And if you need, I would recommend having a professional like a psychologist or a social worker who then debriefs the supervisor, so that they're not alone to handle some of the messier emotions that can come up in the team. So then the last bit, which is really important, I'm not going to dive into in as much detail, but I just wanted to flag, is that we have a huge responsibility to then monitor the work and the safety of the participants and of the team themselves. And so what I like to think about in violence research is clinical trials often do something called adverse reporting, and they usually collect any examples of like injuries or physical harm that occurs because of a trial. But in social science, we may not have any injuries, but we want to look for social harms. So we want to look for any time that a participant or a staff member is put in social harm because of the study. So this obviously would be a time where, like, if a participant experienced a new episode of violence, then that would be a social harm. But it may be that she never gets physically harmed, but that her partner pushes her out of the house for the night and says, go stay with your sister, I don't want you here. Any of these kind of social harms, we need to be documenting and reporting back to our ethics boards. It's really important because, as Mokhantso says, we're learning as we go, and we want to be able to show ethics boards and our wider research audience that we've been very careful about safety. So the SVRI, which is Sexual Violence Research Initiative, is an amazing resource for Southern African researchers on violence. And they recommend that we have 7 things in place before we ask about violence in a COVID study. So I think we've talked about each of these, but just to reiterate, we want the findings about the violence to be actionable. We want to be able to say, we'll translate those into real programs and real policy. You want to have someone on your team who's used the exact research method you're proposing before, because now they're going to have to be a little creative and do it in COVID times. You obviously need to make some major plans around safety for participants and staff. You have to update your referral list specific to this time. You need to have plans in place to make sure your research team is well and responded to. You have to do the training, and you should have a section on remote data collection in your training. And you need to have an ethics approval in place so that you can show that you've been thinking about this in line with ethics. One really important lesson we've learned in the last year, there was a study with young women that we are going to do WhatsApp quizzes and texts. And we realized that if we wanted to ask about violence from these young women in South Africa via WhatsApp, we needed to have more robust referrals in place so that they could talk to a counselor if they needed to, if they felt distressed. The research team at first, they had brought me on as a violence expert. The research team at first said, I don't think we can ask about violence. It's just too hard to do. And I encouraged them to return to the funder and rather ask for more resources to do the violence items well. And the funder immediately responded with a supplement so that we could ask the violence questions well. So I would encourage you, if you're leaning toward asking about violence, instead of shying away from it and saying, I don't know how to do it well, get the resources you need, get the experts on your team you need, and go do it well, because we really need that data to make good program decisions. So none of this thinking is mine alone. I'm really building a lot on the backs of people who've been doing this work. But if you have any questions or are interested in being connected to a South African expert on violence, please do email me. I think that, just going back to the slide, I think that we have a big blank spot in South Africa, and indeed in all low and middle income settings. We need to understand how COVID is influencing these relationships to keep our women safe. Thanks.
Thanks so much, Abby. That was, again, a really fascinating contribution. And it's been really wonderful to have it following on after Mokhantso's broad overview, to have this very particular and focused set of examples. And I think you've shared some really useful and practical tips. I think we do have a little bit of time for questions and answers. If you maybe want to turn your screen share off, then Stembiso can share the set of questions he's managed to record. If anyone else does have questions at this point, feel free to pop them in the chat box or raise your hand.
Okay, great. Stimpy, so can you please put your slide up once again? I did see before the slide. Mm-hmm.
Yeah, it popped up briefly and then it disappeared.
I can answer the first one. Okay, great. So recall bias is a really good question. It's really hard to ask people about time frames without an anchor. An anchor, like meaning an event. So I think that you don't need to worry about recall bias during COVID, because for most of us, this is a pretty obvious thing. I think that it's going to be hard for people to know what a year before that meant. So it's not going to be a perfect response. What I would recommend is you don't actually analyze that data. You don't think about that as prevalence data, but rather just think of it as an indication that someone was already in a violent relationship. In other words, I don't think you can get around the potential recall bias. For reconfirming the identity of a respondent, Tara, that works better when you are doing panel data or you're following up a cohort. You could, when you consent them that's a good idea. When you consent them the first time on the phone, you might say, hi, I'm so-and-so. I want to schedule an interview with you. When can we do it? Okay, great, we'll do it on Wednesday. May I ask you your sister's maiden name or something? I'm gonna just check in with that secret question before we start our conversation on Wednesday to make sure we're speaking to the right person. Okay, Rahi, those are some great questions, but I'm actually not the right person. What I would recommend is if you can watch the video from the last session, those speakers are actually the right people to think about sample sizes and how to choose. Lebahang, yes, great point. There could be some really important research that already does exist, especially in the gray literature, the program data. Good call. Let me reach out to you afterwards about, I wonder if we could just create a little bit of a shared set of documents for the data that does exist. Okay, Pascal. Certainly, you can always ask men about their partner violence victimization. So I often speak about women being the victims of partner violence because 96% of the survivors of partner violence are women, and men experience it much less, but that's not to say it never happens. And it's possible that you might want to expand to think about family violence, in which case certainly young boys and even men might be victims of family violence. So I think the lessons I had can apply to any type of violence, but my own experiences in partner violence, which is usually male to female, particularly in South Africa. Next slide.
I think that's everything that's come through at the moment.
Nice.
Thank you so much for those responses, Abby. We will share the questions and their answers with colleagues after the seminar as well.
And also just to say, I know your video will be online, but if anybody would like the original slides, I'm more than happy to share them. So they can zip me an email and I'll send them.
Great, that'll be really useful with the links especially as well, I think. We will also stick them up on our website, if that's okay with you. Thanks so much, colleagues. So I think at this point, we would like to welcome Mfundo Majola to speak to us. Mfundo, over to you.
Thank you, Julia. I do not have a slideshow, but I will talk you through our project, which is the Lockdown Diary project. I just want to thank Abby for a really interesting presentation, and it also speaks to the problems in terms of ethics that we encountered during the project, in terms of certain questions that we thought were too sensitive to ask, especially questions that are around gender-based violence. But I'll explain more in the presentation that I'm about to do. So my name is Mfundo Majola. I'm a researcher at the University of the Western Cape, and I'm part of the Lockdown Diaries team. The team that also includes Fiona Anciano, Meli Dube, Boitumelo Papani. They're all based at the University of the Western Cape, and SJ Cooper Knock, she's based at the University of Edinburgh. In the talk, I'm going to introduce you to the project, provide you with an oversight of the methods, and reflect some of the ethic protocols we developed and some of the questions that still remain. As many of the researchers in the series have noticed, this is a new time, and many of us are still trying to do work in the midst of trying to make life work in the midst of a crisis. That means our work isn't always perfect and our practices are evolving. And what we're showing here is that it's the sense of that process. So let me start with the background of the project and the team. Before the world was hit by COVID-19, we were in the process of conducting research in Imizamo Yetu. It's a community in Hout Bay in Cape Town. We're in the process of examining the impact of the fires in 2005 and 2017, what impact they had in the community where hundreds of people were displaced, the response from government, and how that has changed the community dynamics. We're in the process of interviewing community leaders, members of the community, and various community members and public officials. When the COVID-19 disrupted the process, but also gave way to a different project, and that was the Lockdown Diaries project. So the Lockdown Diaries project seeks to establish how the COVID-19 lockdown is being experienced in different areas across Cape Town. We were interested in understanding how lockdown was affecting people's everyday lives experiences and how people reflected on these changes. So I have to mention that the Lockdown Diary project has over 70 participants who are from informal settlements, occupied buildings, township, and suburbs throughout Cape Town. And participants are diverse in terms of their location, their gender, and race as well. So some of the participants are from our various network of research and in communities that we've conducted research in. In some cases, they are part of our social networks as well. So how did you conduct the research? We decided to do the research through WhatsApp. We began by having a baseline survey in which the survey gave us a bit info on the people that were going to be part of the research. So we asked about their households, their occupation, their access to services before and after the lockdown began. So after that, we started a WhatsApp diaries encouraging people to send us reflections of their everyday experiences. Fairly quickly, we realized that not everyone was used to a diary format. So we developed prompts that we can reflect so that people can reflect in their diaries. So we're interested in participants' lived experiences and their perceptions. And the advantage of doing it on WhatsApp was that participants did not have to leave their homes or break lockdown regulations to take part in the research. Moreover, participants could choose whether they wanted to leave us a voice note or they wanted to write in text. This meant that the format was very flexible, taking into account issues such as privacy and literacy, of course. Using cell phones, we also brought issues as some participants had trouble with their cell phones, and at certain times participants would have trouble responding to diary due to their phone not working. Some of them had issues with the networks in the areas that they live in, as some of the participants lived in areas that had limited access to electricity, so they had difficulties charging their cell phones as well. So we paid a stipend during the research, which was intended to cover the cost associated with taking part in the research. This undoubtedly helped to make the project more accessible. Nonetheless, the reliance on technology in these remote study projects is always going to raise questions about equal participation, how we manage and minimize the digital device, and crucial topic for us to consider as researchers. And one I think we can discuss also in the Q&A as well. So the coordination of the project was also done over WhatsApp between the research team. This was a space in which we could discuss research prompts and check on each other's progress. We would discuss a theme we want to examine. For an example, how respondents access information about COVID-19. We would then formulate the question in the group. And when we have a question that we all satisfied with, luckily that was the case most of the time, we would then send the question as a diary entry for the day. Clearly, as with any project, there are lots of ethical issues to consider. And prior to beginning the research, the project was cleared by the research ethics teams at the University of Edinburgh and at the University of the Western Cape. Again, as with any project, we were not perfect in our approach, but there were a few protocols we developed and some of the discussions we had. The first one was consent. Before any collection of data was done, participants were provided a research information page in isiXhosa and in English. As most of the respondents in Cape Town were Xhosa speaking, so we thought we should have a consent, an information page that speaks directly in their language. Participants had to give consent in verbal or written. They had an option of sending us consent via a voice note over WhatsApp, or write via text. So this was, they had to give consent before taking part in the research. At this point, we also asked participants to choose a name that they wanted to be referred to as in the research. All participants were referred to by their first name only. The second one was data protection. This was a choice that was made between some of the data protection professionals at the University of Edinburgh. Their key priority was security of the platform. On that basis, they recommended that we use Microsoft Teams. Our concern with Teams was that it would be a new platform for many people. Many of us were still learning how to use it for the first time. And we knew from that experience how disempowering and disorientating can feel to try and navigate a new online platform. That is why we decided in discussion with data protection team to go with WhatsApp. This was a platform that was double encrypted, so it's safer than platforms such as Zoom, but crucially, it was a platform that our participants were familiar with. To try and make sense as the process most secure as possible, we would download the responses from our participant at the end of each week and deleted them from our phones. We would then upload the data into a shared project folder on OneDrive. Having given a sense of some of the basic ethic decisions and protocols we had adopted, I wanted to give you a brief sense of some of the ethical decisions we had during the project. The first issue was more of a debate that we had in the team is how do we deal with sensitive information about evolving situations? So in one of the diary questions we sent to participants, we asked if there's someone close to them who has had the virus, COVID-19, and if there's any negative stigma to having the virus. We received one message from Imizamoyetu in Hout Bay, which detailed threats that were rumored to be going around the settlement against people who have COVID-19, namely that they would be burnt out of their houses or killed in order to protect the community. Normally, we do not report every threat to authorities that we hear in interviews. In this instance, though, the threat was emerging in a settlement that we knew from our own research had previously burnt down community leaders from their homes, and when those individuals were seen as a threat. So given this history of collective action, we considered that the threat we heard to be serious and potentially credible. But the question remained, what should we do? And this was a reflection on broad conversations that were underway in the neighborhood. There was no specific aggressor or victim who was being named. We do not want to risk encouraging clumsy intervention that could perversely escalate the situation. And of course, we needed to protect the identity of the individual who shared this information with us. We had discussion as a team regarding this matter, how to approach it without causing further panic in the community and without giving the rumor any validation. The team came to a conclusion that we will notify the leaders of the community that there are rumors that people with the virus would be burnt out of their houses. We notified the leaders while keeping our respondent anonymous. This enabled the community leaders to remain vigilant to these rumors and to step up efforts in terms of tackling them and stopping anything that could feed the rumor. We were also able to do this because we had an existing relationship with the community leaders, and we knew and had a sense of their relationship with the community. And the second dilemma or issue that we had was that which questions do we ask? What could we ask the respondents? Because we didn't want to ask questions that were too sensitive. The second challenge is that one of the early debates we had around the question of income. Clearly, a lot of households have been affected by COVID-19. People not being able to go to work, or their capacity to work has been affected. Therefore, we wanted to explore how income has affected people's experiences during the lockdown. The difficulty here, however, was in twofold. Excuse me. The first one, we wanted to be careful about diary prompts that came to be asking insensitive questions around people losing their jobs, getting laid off, or taking salary cuts. And this was an ethical issue. But there was also like a methods issue, the meeting point between people's subjective reflections and the objective details of their material circumstances. The latter is incredibly hard to measure without large number of questions, which was certainly beyond the reach of a single day prompt and also beyond the reach of a short, intrusive baseline question. So for a mixture of ethical and methods reason, income was an area we explored largely indirectly. And also this question of sensitive topics was important, and a recurring question for us is that which questions are too sensitive to ask via WhatsApp. And in our diaries, we were keen to talk about issues that were likely experienced directly by participants or broader communities, as well as issues of debate that were in the public sphere. And yet we were keenly aware that remote research we were doing placed a lot of limits on us in terms of our capacity to read the situation, to ensure that we weren't traumatizing or re-traumatizing people, and in our capacity to control like the broader environment in which the conversations were taking place. The shift from face-to-face research to remote research was a significant for us because it kind of limited our reading of the situation. Was at times you didn't know in what mood or and what kind of setting this person you're asking these questions is in. So therefore, we felt that some questions like those around gender-based were put off limits. That we felt that others, like the question of police violence, could still be approached, but with sufficient sensitivity, largely because we could ask about community responses to cases that have happened elsewhere. Again, though, there's really easy answers on these topics, and this is something I would be really love to hear in the Q&A. And then in closing, perhaps it's worth pulling back from the issue of sensitive questions to a question of sensitive times. Remote research methods allows us to do research in contexts where research would not be able to happen otherwise. But these two raise big ethical questions, and one I would like us to think about is, are there points in a crisis where trying to do research becomes inherently unethical? And how do we draw this line as researchers? And how, as a research community, simultaneously being affected by the crisis, draw lines collectively for our participants and for ourselves as well? Thank you.
Thanks so much, Mfundo. It was really wonderful to hear that reflection on how it has been to implement a project like this during such an unusual time. And I think I really appreciate your openness in sharing some of the challenges and the questions, particularly around ethics. It's really interesting again to reflect back to the sort of broader issues that Mokhantso outlined for us, and then what they look like at a very concrete, practical level. I'm just checking here. I'm not sure that we've had any particular questions come in for you. Does anyone have anything that they'd like to ask? I'm not seeing any hands. So there you go. You've got a new question.
Okay.
Whether
we started the project as soon as the president announced the first lockdown. That was in early March, and we recently stopped collecting data, as we were collecting data on. We first started with collecting data 3 days after. We collect 3 days, 3 times a week, and after that we soon moved on a weekly basis. And we stopped on the first week of July. Yeah. So it was 3 months and a couple of weeks.
And can I ask whether you've got any thoughts around following up with the participants again in future?
Yes, there is a plan in terms of following up on the participants and actually going to each participant and interviewing them where they're from. We're still in the process of figuring out how can that happen, and also navigating through COVID-19.
Wonderful, thanks. Oh, and a question from Lisa.
Thanks, Julia, and thanks, Mfundo. I wanted to ask about the kind of quality of data you got back via WhatsApp. Often people's WhatsApp messages are quite abbreviated and sometimes quite ambiguous. Did you think this was a useful way to ask people to provide this good, rich, qualitative information?
Thank you for your question, Lisa. Yes, it was. For us, we gave people an option in terms of sending us voice notes. So we would ask them about a certain theme, for an example, access to information or food parcels. So people could tell from their own experiences or from their own community experiences. It was different. Others were more sharing than others, and others wanted to share more because it affected them directly, or they know someone that was affected by the issue directly. So it differs, but we felt that we got really rich data, that, and also WhatsApp is a very private setting. So people were able to chat to us even in their homes. Some of them were on their way to work, and they were able to send us voice notes and explain what they were going through.
Thank you.
Thank you.
Thanks so much. So at this point, I think I'm going to hand over to Tara, who will just help us wrap things up and pull everything together. Thanks, Tara.
Thank you, Julia. Thank you so much to all three of the speakers. I mean, that was absolutely fascinating. And I mean, it's great to hear not only that so many ethical questions are being asked, but that there's some interesting creative solutions in the offering. And I think the point of this seminar series is really to kind of get into the nitty-gritty practicalities of how to do these things, which came out today, which was really fantastic. I just wanted to check. I see that Mokhantso has answered a lot of her questions in the chat. Hopefully all the other participants can have a look at that. Everyone else has sort of answered their questions verbally. I think we will circulate, and it'll be on the website, the actual questions that were that were asked, because so often those are a big part of what's interesting. I actually wanted to ask all three of the presenters to maybe say very briefly whether anybody has done sort of meta research on respondents' responses to remote interviewing processes. Basically, you know, maybe asking your WhatsApp panel how they feel about being asked these questions over WhatsApp, or if there's anybody in the ethics applications to HSRC who is sort of building in a self-reflective process of actually checking in on how respondents feel and sort of, yeah, what they're saying about the process of being interviewed in the ways that we're trying to do now in this socially distant way. And, you know, Abby, if there's anything that you know of where people are actually asked, I mean, a lot of your talking about consenting and reconsenting sort of gets at some of that, right? But it'd just be really interesting if any of you know if there's any meta work on that, which wouldn't necessarily need to be COVID related, but it could have been from before as well. So, Mokhantso, can I start with you to see if you've got any comments on that?
Thanks, Tara. Thanks for the question. Not at this point. I think at the moment, people are busy conducting studies. So there hasn't been a moment and opportunity for reflection. But what you are raising is important because we need to document how this new way of doing things is being experienced by those who are participating in these studies. But not at this point in time. Thanks.
Thank you. Abby, any thoughts?
Yeah, I'm actually a little bit worried as well. I love your meta question because I think we're all kind of so aware of what a huge change this is in all of our lives. So we're kind of rushing to get to the field and rushing to get our answers. And that, you know, there is such a sense of urgency, but then what we lose is that thoughtful kind of overarching question around, like, how is this feeling for people? How are teams managing? Not to mention, are we asking the right questions? And, you know, so I think there's like a sort of a few different meta layers about survey design, about how interviewers are finding it, and about how participants are finding it. That would be wonderful. I'll see if I can find anything on reflections of other remote research, but my sense is it's almost all happening in real time in the field, and not that many people have had a chance to kind of reflect yet.
Thanks, Abby. Mfundo.
One of our last diary prompts that we asked our participants was that how did they find being part of the project? And we really got positive feedback in the sense that a lot of the respondents felt like there were people that were actually listening to what they were going through, to what they were thinking, and to the way that they were seeing their world right in front of them. So they felt that asking them these prompts and these questions also made them aware and raised their awareness of the situations around them, because they had some place to reflect on. They had a platform which they can say how they felt about information about COVID-19, how they felt about the lockdown, how they felt about moving from one level to another level. So it was a really good experience for them in terms of they could have someone that was listening to them, and they can also see what they're also sharing in publications such as Daily Maverick and being published. And it was a big positive feedback from them.
Great, thank you, Mfundo. Looking forward to seeing some of that written out. Well, part of the reason I asked that question as well is that we, I mean, so often, right, and this has been written about a lot in sort of critical ethics thinking that looks at the power imbalance between researchers and respondents so often. That the kinds of impacts on respondents that many of the research designers can think of, you know, we're coming out of, many of us, not all of us obviously, thank goodness anymore, but many of us are coming out of a middle class environment, or just generally a very different language, cultural, educational, income, power environment to respondents. And so, you know, yes, we can think of data costs, etc. But one of the things I read a while back was that someone was saying, well, what about situations where people actually have to leave their house in order to charge their cell phone because they don't have electricity in their house or in their residence? What does that do in a COVID environment when you're not supposed to be contacting anyone? So, you know, how many of us are actually thinking about the ethics of that? We actually built that into one of our early ethics applications for a study we were doing in Alex, and then had to run around and try and find out how many people in Alex, what percentage didn't actually have electricity in their residence, in their shack or their house or wherever they were living, to see whether that was actually, and it, you know, the ethics committee almost kicked out the study because we put that in and said that we'd be worried that just by virtue of talking to somebody on the phone for half an hour, you'd be draining down their battery and then they'd have to go out to charge their phone. So, I mean, I think that, you know, there's sort of everyday details about impact that on respondents that we don't necessarily have all thought through quite yet. And that might apply in some situations, might not in others, you know, etc. And so that's why I think these kind of meta reflections and actually going back to respondents and saying, talk us through the actual everyday experience and what it means for you to be involved in this. And then maybe somebody will say, well, you know, actually the experience of being heard is important enough to me that I don't mind going charging my phone somewhere or whatever it is, which one would also then need to respect, right? Because it's, I think, exactly as was said in the very first presentation, it's a balance of impacts. It's not an absolute never do any kind of never have any kind of impact that might have some kind of negative impact, because it's about balancing. What else do we have? Oh, thank you, Fiona, for putting in the link. There we go. Reflecting on the diary process. Wonderful. Is there anyone else who'd like to answer a question? Okay, Mfundo, you've got your hand up. And then I think Julia also had something she wanted to ask. Mfundo, please go ahead.
Oh, okay, thank you. I just want to mention, we also had those thoughts in terms of will people want to go out of their houses and charge their phones in terms of trying to be part of the research. And that's why we shifted in terms of the timeline in which we asked these questions, and we gave participants a certain number of time in which they didn't feel like they had to answer. There were participants who didn't answer certain prompts because maybe they had certain problems with their network, or they didn't charge their phone at a certain time. So I think we made it very clear to them that they were not pressured in terms of answering a question or responding at a specific time. We made sure that we send the prompts early in the morning, so that the participant had more than 2 days to answer just one question. So we did have those thoughts in asking participants, because some of our participants live in informal settlements where access to electricity is limited, or sometimes they would have blackouts for a number of days.
Great, thank you very much for that. Any other questions? Julia, I think you wanted to say something or ask something?
Sure. I mean, I found the range of questions we've had coming through from audience members really useful as a sort of way to build on the content that the presenters have so generously and openly shared with us. I suppose, I'm not sure if it's a question necessarily, but I would really love to hear from colleagues, whether presenters or members of the audience, about particularly innovative methodologies that they have personally encountered. And perhaps that would be something we can consider looking at having a particular session focus on. I was really interested at the level of interest, for example, in kinds of methodologies, including children, variations and approaches to consent. And there's been some conversation around focus groups and how one might do that. So yeah, just really an invitation to please be in touch or share experiences.
Thank you, Julia. Yes, and certainly anybody who's here as a participant, we're always looking for speakers. So if you have interesting projects or perspectives of your own that you'd like to talk about, please do get in touch with us and let us know what you'd like to talk about. Any last points? We've got 5 minutes left. We don't have to use them. Any concluding thoughts from the presenters? Fundo?
I just want to mention, you guys can visit our website. It's lockdowndiaries.org, and then you can see our work. Thank you for the platform. We really appreciate it. I just want to thank my team members who are also here, Fiona Anciano, SJ Cooper, Oitumelo, Tumi, and Meli Dube. And thank you again for the platform.
Thank you, Mfundo. Abby? Abby, are you there? Any last thoughts?
Yes, thanks.
Yeah.
I loved this opportunity. I think so often we are naturally having these ethical questions with our close colleagues, but it's really nice to have a big picture thinking around, like, well, how are we actually dealing with these ethical quandaries? And I guess the one thought I would leave us with is similar to what Mfundo was talking about with the lockdown diaries. I think lots of us value the chance to be heard. And I think that research provides that opportunity for groups who may not naturally have a voice sort of in policy making or programming. And like, when it comes to violence, that's certainly what we find, is that people really value being asked and value the fact that we're recognizing their experience. So I'm hopeful that we can find new, safe ways to include those violence questions in. Thanks.
Thanks, Abby. Mokhantso, can you give us a closing thought?
Yes, thank you. And I just want to express my appreciation for being involved. And thanks to Ben Roberts, my colleague at the HSRC. He's the one who contacted me about this opportunity. and for reconnecting with Julia. So it has been a pleasant experience for me. And I think what Abby was saying about people appreciating being contacted about research, which I think at this point in time in the context of COVID, for some people it might be that opportunity to speak to someone. For those people who, because of the lockdown, may not have opportunities to interact frequently with other people, sometimes with adults, if they are staying with children. So I think that is something. And one of the things that we need to perhaps be thinking about is whether researchers are received the same way when they are using people's private, private property like a telephone, or especially a cell phone. And when they are visiting homes, is it the same thing? Is it the same kind of reception? Is it the same kind of burden for study participants? I think this is one of the things, especially take into consideration that when we do consenting, it seems like with these new technologies, it has to be done step by step. And that might mean committing to longer time than it would normally be if it was a written consent on a piece of paper. So I think those are some of the things that we may need to take into consideration, and they need exploring further. Thanks very much.
Thank you very much. So I think let's wrap it up there. It's exactly 12 o'clock. Thank you to all the speakers again. Thank you to the participants. Thank you so much, Julia, for all of the background work, for all of this wonderful convening. And we have another session in 2 weeks' time. You planned, you'll all get the invitation. And please do be in touch and let us know if there are any future speakers in this group of participants. So thank you again, everyone. And I think the recording and the documentation will be on the GCRO website. Please do look it up. Please do share on social media, and we will see you all at the next seminar session. Thank you.
Thanks so much, Tara, and thanks so much, everyone. I'll send through a link with the details of